back, everybody. I am sat with Tony Kilcoyne. Welcome, Tony. How are you?
I'm very well, thanks. And hi, everyone.
How's life treating you? You know, media side of things, it's all been, oh my gosh, how's Tony coping
Well,
with
yeah, I mean, life doesn't get boring. I'll give it that. Yeah, it's just, I'm well, family's well, everything's going fine. That's the most important thing. You have to put these things in proportion, you know.
Absolutely.
Sometimes things happen and, you know, you care about it a lot, but actually they're not necessarily the most important things. They're an important thing, but they're not necessarily the most important thing. And I think if we can always just keep putting that back in proportion, you know, that helps a lot. But yes, thanks for asking. I'm very well, thank you.
Absolutely. Anyway, thank you so much for joining me, and many congratulations being placed in the top 50.
Yeah, it's
how did you find out?
Yeah, how did I find out?
Yeah.
Yeah, I think somebody just contacted me and said, oh, so you're in the top 50 again. There was one year where I actually came #1, which is shocking, isn't it? I don't know, it was 2018, 2017. And I had no idea till somebody was, you know, I got a message saying, oh, congratulations and stuff. And that's all it said. And I'm thinking, okay, something's happened. What? Like, the top 50, you idiot, you're #1. I'm like, get lost.
Yeah.
And I think it was the singing dentist then and so on. So I'm in very good company, aren't I, really?
You are.
I know it's a popularity thing, but how many times does anyone in dentistry even get recognised for anything they do? You know, I mean, I'd stick my nurses in there before me because I know how hard they work and they genuinely care for the patients and so on. So we can all think of people who aren't in that list, don't get me wrong, but why don't we just have lots of these type of things? I mean, why is it that we don't, I won't say shout about it, but, you know, we are worthy, we contribute a lot to society, our profession and so on. And I think in dentistry, that's one aspect maybe we don't do enough. The British Reserve I get, but staying silent isn't good either. So in a way, I think this is a good catalyst. It gets people talking and thinking about these things and maybe looking at, well, yes, let's do things in our local community. You don't have to do things at national level all the time.
No. No, and it's just about making that bit of difference, isn't it? And I think that's the one thing that I've seen through the interviews so far is that, you know, if you cut everybody down the middle, genuine is written right through everybody because they genuinely want to influence positive change in our industry. And I think that's what's been so wonderful.
Like Blackpool Rock, it's just
genuine.
We genuinely care all the way down the middle. There you go. You've got a new logo for dentistry.
Absolutely. So Tony, you know, the whole sort of message really through doing these interviews is just to really find out what's kept everybody motivated, you know, what your driving forces are, because, you know, you're a dentist, you've faced adversity like everybody else, but also in your role as well, which we're going to talk about a little bit more, you know, you've really faced a brick wall. You know, what's really kept driving you forwards? I think that's the question.
Yeah, and it's actually a very deep question, that as well. I think ultimately, why do we do anything? You know, and yes, you have to earn money and pay bills and, you know, keep everything functioning. But beyond that, why do we, you know, do these things? And it's usually because we care about them, really. So I think certainly when COVID hit and say all practices had to close, and particularly if you're more at the private end, as my practice was, you're getting no financial help at all. You suddenly think, yeah, all that financial planning in the past of always have, you know, a lump of money for a rainy day. You never know when something happens. You're always thinking in terms of, you know, illness or the building falls down and the insurance will only pay half of it or something. So you kind of, I have fortunately kept a rainy day fund. But all of that had to go to support the practice in the first 3 months, because you imagine you've got zero income, and there's still a lot of bills going out, and I know that's affected many people. I mean, fortunately on the NHS, you know, they got some central help and so on, and, you know, good luck to them, and there's nothing wrong with that at all. But different sectors and different people, I mean, some people ended up not working or ended up losing their jobs and so on. So it is, how do you sort of cope with this adversity in whatever way? Some people have an illness in the family or whatever that sort of knocks the equilibrium out. So it's a case of, I suppose, having some extra resources somewhere, number one, I think some self-drive. And number two, I think having other good people around you, and them giving, you know, moral support, and just knowing they're there, and you've got someone to moan and groan to, which is always good. But they'll listen, and they'll sort of just remind you of the more important things. And I think that's the thing. I think it is just about prioritizing it and seeing it as a temporary storm rather than forever. And I think when you are in the middle of a storm, whatever it is, things can seem quite dark, but I think, what do they say when you're in a storm, keep going, you'll come out the other end. And that's the thing that you have to do. You have to self-motivate and help those around you where you might be okay and you see somebody else struggling, you know, reach out, metaphorically put your arm around them and say, you know, how can I help? I can just be an ear to listen to, or I'll support you, or I'll help you put things back in proportion to what you've got. Your health, you've got your family, maybe you've got other good, so many good things that are actually priceless.
Absolutely.
You can't put a price on them.
You can't put a price on them.
So whilst there are worrying times sometimes, whilst there are events that happen that sort of knock your equilibrium, I think the thing is stay strong. If you're doing the right things for the right reasons, you are on the right path. It's just sometimes it's not a straight path. It has a lot of turns.
No, how do you relate that? Not that I want to get political in any way, but how do you relate that to the difficulties that you've faced at the BDA recently?
Yeah, see, look, no organisation's perfect.
No.
Now, I suppose I am fortunate that these things have happened more, you know, when I'm more than halfway through my dental career, shall we say. So I've had a lot of experiences. I mean, I've been on the GDC board. You know, I've been both elected and appointed there. I've been an examiner for the Royal College of Surgeons. I still currently work for Health Education England, and I run foundation training schemes in the Yorkshire region and so on. So I work with a lot of different committees, panels, hierarchies, and so on. So believe none of them's perfect. You could probably even come down to practice or corporate levels. None of them are perfect. But as long as everyone is kind of trying to row in the right direction, then you'll kind of get there. Again, it might not always be the straightest path, but you'll get there. And as long as that organisation and you want to keep making things better, then you know you are, again, doing the right things for the right reasons. Even if everyone's a little bit different, that's fine. And I'm also a great believer in diversity brings a lot of different strengths.
Yes.
You know, so it's interesting because my daughter's playing in a rugby team. She loves rugby.
Wow.
And women's rugby is really taking off. And
yes.
it's actually very entertaining to watch. And it's not something I would have normally done, but, you know, I watch it. But like a rugby team, you have people of all different sizes, abilities. You've got the fast ones, the strong ones, you know, whatever. But if they don't work together as a team, then it all starts to fall apart. And it's a beautiful game to watch when, if you think they're running forwards but passing backwards,
yes,
they still have to make progress. And I suppose I see a lot of organisations like that. It's not easy, but you all have to. Now, when you see something not working right, it's almost your job to say, look, we really need to fix this. And then if you become the awkward one, you know, suddenly you're the problem when actually, no, you were trying to point out the problems. So that can go horribly wrong. And sometimes you just have to say, okay, this isn't working. And that's okay. So I would say to people out there, you know, if you're in a practice that you've tried everything, but it still isn't working, and the problems are getting worse. You know, we're not talking about a difference of opinion on something. We just said the mechanism, the governments, the processes of there isn't working. And in fact, it's getting more worrying, not even neutralizing. Then it is okay to sometimes say no, point it out, and if things can't change, move on.
Yeah,
absolutely. Move on. It's disruptive, it's upsetting. But yeah, fine, move on, because that is not the right place for you at that time. But I think sometimes you're feeling like it's a bit of a self-failure. And
yes.
you know,
I can understand that.
Sort of say to you, no, step back. Why were you doing it? Why were you saying it? Was it to try and make things better? Yes. So everything else is detail. But if it still isn't right, it don't feel right for you, move. And I think sometimes we're just a little reluctant to both call it out and do that.
Yeah,
so
I think that's a great message for anybody out there, Tony. You can apply that to any part of your life, can't you? Whether it's business, it's family, it's friends, it's
absolutely, yeah.
You can apply that across you know, multi dimensions of your life. You know, and it's not taking it personally, because you know, you can't change everything. There's so much out of our control. It's just controlling how we feel about it, and the way we deal with it, isn't it?
Yeah. And I think, you know, when I look back, I thought, could I have said something earlier, done something earlier? And you go through this little bit of self-blame mechanism.
Yeah.
Sometimes. And of course, anyone can look back. I could tell you what last week's lottery numbers were, but I can't tell you next week. So, you know, but did you do most reasonable things for the right reasons and so on? And if you're content with that, then it's actually, give yourself that permission to say, you know, well, actually, you did what you could, and you did when you could, and, you know, don't be sort of too self-critical. And if something isn't going to work out, recognize it. Yeah, of course, still try and change it, but you don't have the power to change everything either. That's the thing. And sometimes, no matter how much you try and help someone or something, or a big committee or a body help itself, if it doesn't want that, there's nothing you can say or do. Nothing. And at that point, I think you have to then go through the acceptance phase and say, right, what do we do next? Right, well, this is incompatible, so let's change the environment, let's change the practice, let's change the relationship, let's change whatever it needs to be changed. And you do have the power to do that. And I think sometimes we don't give ourselves permission to do that.
Yeah.
But on a more positive note, many things come up. It's been very stressful time in COVID. There's been all sorts of other things people have had to deal with, you know, financial, work stress, all kinds of things, really. But most things are fixed with a good, honest conversation. And fortunately, I think a lot of problems have been overcome. A lot of hurdles have been overcome. We're heading into summertime now. Half the country's vaccinated, and that's increasing. You know, we still have to do all these precautions, but generally, I think people are feeling a little bit more in control, a little bit more positive, a little bit more, I'm seeing the light at the end of the tunnel here. So I think we're coming out of the eye of the storm. Yes, there's rough bits to go through. And I won't say it'll be normal again, but it'll be a new normal, and we'll adapt. And I think that's where we're quite good. I think if you can stay flexible and adapt, if you have to change something, change it. But yes, move on. And I think if you can just keep that momentum going, and it's one of these things, it's easy to say, it's hard to do when you're in the middle of it. But generally, if you can hang on to that and know there's always someone worse off than you. There's always someone who's got it harder and tougher. So you can do this. You just got to make up your mind and do it sometime.
And I think it's just, you know, when you're in the depths of it like that, it's just keeping your eye on the horizon, isn't it? Keeping laser focused on what you want to achieve, and just keep going. Keep going. Easier said than done.
It is interesting, Nicki, because when you look at, I don't know, we all probably admire other people in different places, whether it's dentistry or outside of dentistry stuff. And if you study them and think, okay, what makes them successful? Why are they successful? And some people, they're just, you know, I used to think I was a workaholic till I saw other people, you know, and I'm thinking, I'm quite lazy because I do have dedicated time, right? This is not going to be dentistry time. Not as much as I should have, but I do have it. Whereas I see other people, it's like if there's 26 hours in a day, they'd be doing 26 hours.
Yeah.
And, you know, they talk about only surviving on 4 hours sleep and stuff. I'm thinking,
God,
okay.
I'd be on my hands and knees every day. I survive on 4 hours.
It works for them.
Yeah, it does. But that goes back to what we were saying at the beginning, Tony, about what you value in your life.
Yes,
you've been through a rough storm, which we have, and you've faced what you have. You know what? As you know, things drop through the funnel, don't they, and sort of filter out at the bottom. So, for you, what's filtering through at the bottom right now?
Well, I'm content with kind of what I'm doing, you know, and it's interesting because the biggest part of my week wasn't the BDA. I don't mean that in a negative way, because frankly, even now, colleagues are still messaging me and asking advice or help or whatever. So I think I was doing that pre-BDA, and it just seemed a natural route to try to see if one could do it, I don't know, more officially, more helpfully, more powerfully, perhaps through that channel. But it's not the only channel. It's not the only way to go. And so sometimes, you know, you can be like an octopus, and you can actually try other channels and still help. So that hasn't changed. I still work most of the week in my practice. I still run my foundation training scheme, so I'm helping young colleagues get through all the challenges they've had with COVID. We're planning now to take on these new dental graduates who will have not had a lot of clinical experience, so we're coming into foundation training even less experienced than years. And actually we're doing some really good liaison work with the local dental school, and they're going to actually ask some of us in to help assess their students for not just clinical abilities, but things like communication skills and professionalism, and the management and leadership skills they'll need going forward, and try and bridge that graduate to foundation training transition, so it flows more rather than a sudden change step that may or may not be matched very well. So I think that's actually very progressive of them.
I do
think like that. So I suppose I've been throwing myself more into those things. So, you know, I'm kind of realizing I can still do everything I did and maybe more, just more freely now. So that's what's kind of come out of the bottom. And I kind of wished, I suppose, not so much I'd realized that earlier, but that I'd realized how that was okay earlier. Because I almost felt, yeah, if I don't help get these positive changes at the BDA, I've failed. And when I realised actually it wasn't my failure, then I could relax more about it, really. So yeah, what's filtered out at the bottom is keep doing what you've been doing, because you're generally doing it for the right reasons. And it sounds almost like, oh, aren't I wonderful, I care. It's not that. It's like I hadn't realised how good that makes me feel to do that. It's almost selfish. It's not great, you know. It's like, oh, actually, I can help these people. I can sort of give them ideas of how to overcome that barrier.
I don't think that's selfish. I think if you get up in the morning and enjoy everything that you do, and you can help one person every day, if not more, you know, I think that's my ethos. If I can help one person every day, I've got up and made a difference to the world.
Actually, that's a great point.
Little way.
Yeah, I mean, I had a patient today, and fortunately we've done a lot of dentistry for them at the beginning of the year. But between their checkups, they've been into hospital, had a kidney tumour, had a kidney out, been dreadfully ill, and had turned up today for their checkup, and it's the usual, hey, how's things since last time? It's like, well.
Yes.
And he was cheering. He was cheering. Because it's like, look, I can survive with one kidney. I've been through this dreadful thing. But isn't it great they found it and they were able to do this during COVID?
Yeah.
And he was so grateful for life and everything. And of course, you come away and you think, okay, I was going to have a moan and groan about, you know, oh, we're 10 minutes behind or whatever. This PPE is starting to get a bit onerous. And you're like, okay, people have got bigger problems. But he genuinely appreciated the care we were giving. We genuinely appreciated having that conversation, you know, whether you want to call it rapport or whatever. I think that's what makes dentistry great. And you hit the nail on the head when you said, if you can enjoy doing what you're doing. And I think if we can connect with our patients, have that rapport, they kind of become your dental family in a way.
Yeah, they do. And that emotional connection is so important for the patient as well.
Yes.
You know, because it just builds the whole loyalty of the business and the trust, the respect. You know, if they see you as somebody with integrity and who's authentic. And
it does, you know, even though those were difficult areas to talk about, you came out feeling, oh, isn't this a great job? And then it's like, oh yeah, the dentistry, yes, right. We need to do a bit of perio and we need to do a bit of, you know, and suddenly it's like, oh yeah, there's that bit.
Yes.
And it's interesting, isn't it? So I think, you know, I would say, and you've hit the nail on the head with it, if you can enjoy what you do, if you can integrate that and make it, of course, dentistry is always hard work, but it helps make it feel less like work and more like you're doing more of what you want to do. And again, you might have to change your environment or get in control of that environment to have that as your ultimate goal. So some things don't happen all at once. They might take a few years to develop.
It's not revolution, isn't it?
Yeah. A team ethos like that. You've done stuff like that, haven't you? I remember visiting you in Humberside, and your practice was doing, you know, oral cancer screening and all kinds of things. Way before it became the norm.
Yeah, you came into our practice, Tony, because we had VTs, as they were called then. You were running the foundation program way back then as well.
Yeah.
Yeah.
So I think if we're all always doing things that, you know, just make that extra bit of difference, and yeah, we shouldn't feel bad about feeling good about it, because as you say, if that's the happy working environment, then hopefully there'll always be the odd day you don't look forward to going in, but most days you will, and that will help you face all these challenges in dentistry. Dentistry is a tough job.
It is.
You know, it is tough. It's
It
mentally and physically to a certain degree demanding, and everybody's different. You know, but that's both the variety as well as the challenge.
It's such a good mix, isn't it?
Yeah.
So Tony, before I leave you, is there one message that you would like to leave our audience with? You know, for those people who are really struggling, you know, maybe what's filtering through their funnel is mental health issues, lack of motivation. What message would you leave them with?
Yeah, I would say one of the biggest negatives of the last 6 to 12 months is it's easy to become isolated. It's easy to become stressed. Now, if not everyone's fortunate to have a good circle of family and genuine close friends support. And if you don't have that, you know, there's lots of places you can call, even for a chat. You know, if you're a BDA member, they have Health Assured, and that's included in the membership. If you're not, or you want to speak to a dentist confidentially, then there's Confidential. And again, you can just Google these and you will find the contact names. There's Health Supports Trust. There's always someone you can speak to. Why not? Just pick up the phone, chat to them. They're usually people who've been through similar things and have helped a lot of people in similar circumstances. And once you realise, oh, it's not you, it's the circumstances, and it's just having a plan to deal with those. So even if you're in a slightly darker place and you're not sure what to do, reach out. That's my number one message. Reach out. It's very hard to do, I know, but reach out, speak to others, and there's even like confidential phone lines if you don't want to speak to close family, because not everybody does. So definitely reach out. On a more positive note, patients actually, I think, have maybe appreciated us more because of COVID and the lack of access. And, you know, does absence make the heart grow fonder? I don't know, but I think people are a little bit more appreciative. They're glad to see us. Maybe not everyone, but I think generally there's more of a feeling about that. And also I think the potential, people have realised actually dental health is part of our general health. It's more important for our well-being. And I think going forward, you know, whether you're a dentist, a valuable clinical team member, a non-clinical team member, whatever, going forward, the need for you and the satisfaction you can get from your work is only going to go up. The demand for that is only going to go up. And I would imagine a lot of dental plans are going to be doing some great business over the next 6 to 12 months.
Yeah, most definitely.
I really do. And I think that is going to show you how people value us. It's not just about pounds and pence. You know, value is about so much more than that. And I think dentistry has a fantastic future going ahead. And there's no reason why you can't be part of that. But make the environment something you enjoy working in and develop where you are and improve that as a team.
Brilliant message. Perfect. Tony, it's been a pleasure to talk to you. I could talk to you all day, given the chance.
I can't believe the interview's over. We're just getting warmed up.
I know. We need to do part 1 to 10, don't we?
Yes,
something like that.
Tony's chats.
Well, thank you so much for joining me. It's been a pleasure. Many congratulations again, and keep up the amazing work.
No, well, thank you, and thanks to all the dental family out there. You know,
absolutely.
Very good. Thank you.
Okay, you take care, Tony. Thank you so much.
Cheers.